So we earlier looked at what various ways in which you can be able to classify heart diseases, congenital heart diseases. So say one of the ways is you are trying to classify it based on severity. If they are able to make the baby's body turn bluish, that's cyanotic ones, or if the baby will have these issues but their skin is still normal, that's acyanotic ones. Now, I also say there's another way in which you can classify this disease condition, and this one is based on the direction of flow of blood. So the blood can be moving from left to right, or the blood can be moving from right to left. Now, this tests your knowledge of knowing the parts of the heart. If we're saying blood is moving from left to right, what does it mean? Left side of the heart handles which type of blood? Oxygenated blood. Right side handles what? Deoxygenated blood. So we're saying blood is moving from this side to this side. Alright? So we're not saying this is a disease condition on itself. We're just saying it's a way of classifying these disease conditions. So what type of heart disease conditions could make blood move from left to right? Let's look at them. So what we have here is they are a common category of congenital heart diseases. This is where oxygen-rich blood abnormally flows from what? The left side of the heart back to the right side of the heart. I've already explained everything. Left side handles the red blood, which is oxygenated. Right side is deoxygenated blood. So oxygenated blood is moving to what? The right side. Do you understand? So the only issue that the person is having here is he's not receiving sufficient oxygenated blood. Alright? Oxygenated blood is still moving back to the lungs to be oxygenated again. The heart is working on what it has already worked on. So this rerouting increases blood flow to the lungs and can lead to a lot of complications over time. So what causes it? What are the examples of heart issues that could cause blood to move from the left to the right? We have atrial septal defect, we have ventricular septal defect, we have patent ductus arteriosus. These are mainly the three conditions that could make blood to move from the left to the right. Okay, so how should this shunt work? Normally, the left side of the heart pumps oxygenated blood and the right side is deoxygenated. So blood from high pressure, that's the left side, is leaking to the lower pressure side, that's the right side. So this causes what? Blood moving to the lungs to be too much. So the lungs is receiving too much blood than it's needing. Okay, so what will now be the complications? The heart is having the lungs is having an hypertension. So there's hypertension in the lungs, that's pulmonary hypertension. The right side is overworking on too much volume of blood, leading to right-sided heart failure. Then we have a special condition which is known as what? The Ensign-Megan syndrome. Okay, now we'll talk about it on a special case. So in children, there's rapid breathing, there's poor feeding and growth, frequent respiratory infections, fatigue, exercise intolerance. So diagnosis, imaging, of course. Treatments, you're just trying to manage the symptoms, then repair any opening in the heart that is not supposed to be there. Okay, so basically it's a surgical thing. Okay, so that's it for this.